All right, so hello everyone. A good morning, good afternoon, and a good evening to all our viewers across the globe. And welcome to the Innovations in Aging Research webinar series. So it's 12 o'clock here in our part of the United States. So if you're with us at 12 o'clock noon, then you're having your monthly dose of lunchtime webinar with ACRM's Aging Research and Geriatric Rehabilitation Networking Group. Thank you for having us with you during your lunchtime. I am your host for this afternoon. I am Noemi Maureen Lansang from the Pearl of the Orient, Philippines. And I'm your friendly neighborhood mad mind working on sound and acoustics rehabilitation in geriatrics. So this webinar is brought to you by the American Congress of Rehabilitation Medicine, Aging Research and Geriatric Rehabilitation Networking Group. So we are still welcoming new members. So if you're interested to come and join us and enjoy researching on the aging population, please visit our webpage. It's flashed on your screen. And if you're a little bit shy, you can still contact our chairperson, Dr. Patricia Hine. It's also flashed on your screen. We would love to hear from you, and we would love to undertake collaborative work on aging research. Let's make magic. So it's really fun to do these things in this organization. So please come and join us. All right, so for today, there we go. For today, our speaker is Dr. Donald Manlapaz, and he will be speaking on exergaming for older adults with osteoarthritis, from gaming to training. So before we get started with the presentation, I do want to advise that this meeting is being recorded. So I'd like to request all attendees to please keep your phones and microphones muted and keep your cameras turned off throughout the presentation. We do expect to have around 20 minutes available for discussion at the end of the webinar. So if you have questions, please type them in the chat feature and we will address as many as those as we can during the latter part of the hour. Okay. So without further ado, it is my pleasure to introduce our guest speaker this afternoon, Dr. Donald Manlapaz. He finished his undergraduate and master's degree in physical therapy from the University of Santo Tomas, Philippines, and he finished his Doctor of Philosophy in Physiotherapy from the University of Otago, New Zealand. He is the current program chair of the Physical Therapy Department of the University of Santo Tomas. He is also the former vice president of the Philippine Physical Therapy Association and a lifetime member of the said association since 2007. He is a researcher of the Center for Health Research and Movement Science and the associate editor of the Philippine Journal of Allied Health Sciences. He published and presented his research papers in the field of osteoarthritis, exergaming, and of course, geriatrics. Currently, he is the recipient of the 2020 Outstanding Professional of the Year in Physical Therapy, given by the Professional Regulation Commission in the Philippines. So ladies and gentlemen, I give you Dr. Donald Manlapaz. Doctor, the floor is yours. Please pull up your slide as I remove mine.
Hi, good evening, good morning, good afternoon, everyone. So is my audio clear? Thank you. So just want to share my slide. So I hope you can see my slide. Can someone confirm if you can see my slide?
Yes, we can see it.
Yes. Hi. Thank you for that generous introduction, and it's really my pleasure to share my study on exergaming, particularly in individuals with knee osteoarthritis. And I'm concentrating right now from gaming to training. So hopefully everyone is okay amidst the pandemic that we are experiencing. I know we have different situations across the globe, and I hope you are all safe and ready to listen with my sharing and my experience dealing with people with knee osteoarthritis or individual with knee osteoarthritis in my research and in my clinical experience. So this is the University of Santo Tomas. back in 2008, I've already started doing some small research size experiments on Nintendo Wii Fit in particular. So I'm really fascinated about those features of exergaming. But during that time, it was being used as an active gaming only, particularly for neurologic patients. But when I further my study and go to my PhD in New Zealand, I realized that the use of exergaming does not end with the geriatric population or even in pediatric populations, because during the start of my research about exergaming, I'm actually using it with my pediatric patients. During that time, I was a new physical therapist or new physiotherapist. So I decided to change my career going to geriatric population, particularly focusing on orthopedic conditions. So in New Zealand, my PhD is all about osteoarthritis, exergaming, and falls. And as we all know, osteoarthritis and falls are two important considerations right now for our geriatric population, particularly given the context of COVID in the year 2020. So what will be the outcome and expectations for this session? So we will define exergaming and game-based exercise. I know some of you know these techniques, but let's try to differentiate exergaming into a virtual reality or a virtual reality in rehabilitation. And I'll be explaining the different use of exergaming and highlight its usage to older adults. And then, of course, lastly, let's try to recognize some strategies and how does this individual who experienced exergaming continue their exercising or engage into this kind of technology? Particularly, this technology was created for entertainment at first, and they created this exergaming or this gaming modalities for children or even younger adults. But how does older adults perceive this kind of platform? So I don't know if you still remember this one. So back in the 90s or 80s, we have the Atari game. And then, there's also Family Computer, those N90 and series of Nintendo Wii. So, but back in just near 2000 and 2010, there's Nintendo Wii Fit, and then there's also Kinect. And this gaming, try to compare it into a high cost virtual reality. So technically, virtual reality can be a basic and enhanced. So it is based on the equipment that they use or accessories, it's like the handheld based, monitor based, or it can be enhanced, wherein a participant or a patient can be partially immersed or fully immersed with the virtual reality. And then they use of course the walls are created with videos, with televisions, or they can use the monocular head based gear like in Oculus and HTC, right? And then of course they can create a laboratory wherein they can simulate a specific task. Okay, so it depends now if it's non-immersed, semi-immersed, or fully immersed in the virtual reality. But let's try first to define what is exergaming. So exergaming, they say that it's an ability to tie up a specific game into an exercise. It can be a video games that also provide exercise or playing while exercising. But based on my research and based on the different definition of exergaming, I know in the United States, they use the word game exercising. So it's the other way around. But I'm using the term exergaming. So it's similar, active video game. But when we really talk about exergaming, there should be different components. Okay, this this actually in the perception of or the view of those who are doing physical activity or physical active activities. So for example, doing exertion or doing some activities beyond what is minimal. So when you talk about exergaming, this one is to improve your physical fitness with an intention, plan, and repetition. So there's an exercise component. Also, there's an overlapping exergaming. So it's about playing the video games. But to become an exergaming, for example, a platform, a specific platform, a specific video games, there should be a target outcome. Okay, the target outcome should be maybe increased flexibility, balance, an intervention, or you can use that for endurance training. So if you combine the exercise and the video game that target a specific outcome, then there's an exertion, then it's considered as an exergaming. So it's not about those who are just playing the video games or even mobile games like Mobile Legends or other games that you can play in the computer or play in on with your mobile or smartphones. It's more on thumb exercising rather than active gaming. So there should be an exertion and there should be a target outcome. Okay. So as I mentioned a while ago, exergaming falls under a non-immersive virtual reality to a semi-immersive virtual reality. When I talk about immersion in virtual reality, it can be non-immersive, wherein you can still have the outside environment. You can touch, you can hear the sound. For example, if you're playing and you're hearing the sound, for example, of the television nearby, then you can still hear it. That's a non-immersive virtual reality. A semi-immersed, if you look at the on the screen and you see some of the laboratories wherein they can have this a wall and they can project, for example, the games, and still somehow the participant or the one who is doing that specific exercises still know that still in the laboratory. I can have some again external cues. Then it is considered a semi-immersed virtual reality. But when you talk about full immersed virtual reality, you're now inside and you don't have any outside of or external information coming in. So like, for example, if you place a head-mounted gear on your head and you just simply use your hand to manipulate, now you are fully immersed in that specific virtual reality. So Exergaming is more on the non-immersed side and a semi-immersed virtual reality. So should I say so? But going back again to the history of exergaming, it's already in the early 90s, wherein people are exercising with, for example, the dance revolution, wherein they're just playing and then they're just enjoying the game, right? So they're just enjoying the game with kids, with their relatives, even with their grandfather and grandmother and nannies. So they just play. Okay, so but during the time, the reason for playing is that we want to beat, of course, the physical inactivity that causes now obesity, right? So I remember there were some news that it is already part of the physical education classes, that exergaming is part of it. So particularly younger adults and teenagers will play exergaming. But the question with the involvement of this technology, like for example, having a console, they started to shift from gaming to a training. So training for exercises, particularly playing yoga in Nintendo Wii Fit, boxing, tennis, sports related. And with the advent of this exergaming, as we all know, there's a lot of peripherals that they created. So they have some initial sensors, a sensors rather for the balance, and of course the camera system where it can detect now motion of a particular individual playing a specific game. So given that concept, I was thinking that if this technology is really created for fitness and for health purposes, I think the industry should inform and should involve physical therapists and other workers or healthcare professionals to give some feedback on how to use this one and make this specific platform beneficial for not just for, again, for younger generation, but also for the geriatric population. That's the reason why I'm in this session. Let's try to integrate this exergaming into these two pressing concerns for our geriatric population. And that is, of course, the knee osteoarthritis and falls, which is very common. And then we will discuss the relationship of falls and exergaming, and later on, connect these two using specific intervention to prevent falling or to decrease the risk of falls, and of course, to improve balance, because that's one of the components that we need to check in order, of course, to decrease the incidence of falling for our geriatric population. All right. So over the last decade, there's actually a clear demographic of increase in aging, right? And interestingly, in every country, In every country, we will experience a substantial increase in the size of population of age 60 years old and older between 2015 to 2015, right? And aside from the socioeconomic burden brought about by this rapid aging, health concerns also contributed into its burden. Like, for example, living, affecting their activities of living, their recreational activities and leisures, and of course, the quality of life, which is very important right now. So cognizant with the scenario of the aging population, there are certain issues that are expected to be a challenge. So if you look at this one, the global burden of disease back in 2016, still osteoarthritis and falls are actually high on the list, right? So you will see that falls is still number one, okay? Particularly, this figure will show to you the years lived with disability for all ages and gender, particularly with non-communicable and some injuries. But however, there might be even more compelling evidence with the burden of osteoarthritis and falls in our population of interest. So why knee osteoarthritis? Aside from being the most prevalent musculoskeletal condition, chronic condition, this is highly prevalent globally. Both the prevalence and the risk factors are increasing, and the significant impact of years life loss due to disability. Particularly, the Osteoarthritis Research Society International would try to tell us that osteoarthritis is not just an ordinary condition, but it's a serious disease. So when we talk about osteoarthritis, we go back again to the pathology. Why osteoarthritis, right? It's some it can be categorized into a non-inflammatory type of arthritis, right? But if you look at the level of the joint, you will see at the side that a damage in the joint may be caused by an abnormal stresses or abnormal cartilage. And abnormal stresses can be caused by obesity, anatomical abnormalities, loss of joint instability and trauma. And then if you try to look on the abnormal cartilage, it's can be aging, genetic rather, and metabolic diseases, inflammation in immune system activity. This will lead to a biophysical and a chemical changes and cartilage breakdown. And you will see here that there is a failure of the joint repair and an imbalance between the processes of degradation and repair. And this is to acknowledge that OA is really a metabolic active process. But if you go back to our premise about falls, these symptoms of pain, stiffness, weakness, instability, and functional impairment, these are considered as clinical manifestation and characterization of people with knee osteoarthritis. But let's take note the interaction of these symptoms that alters the integrity of the knee joint. So going back again to falls, you will see that, of course, we know all that falls are the leading cause of morbidity and mortality in the aging population. And approximately 15 to 33% of adults age 65 older experience a fall every year. Okay, that's according to the World Health Organization. But if we go deeper and look at the risk factors, you will see that there is an overlapping risk factors for falls and risk factors for osteoarthritis, particularly the age, the gender, or the sex, the female sex, obesity, aging, and joint trauma, right? So there's some overlapping. So I was thinking during the time that falls actually common also in osteoarthritis. It says that the individuals with osteoarthritis are at greater risk of falling compared to a non-OA group, and 30 to 50% of individuals with knee osteoarthritis reported a fall during a previous years. Okay, so there's an overlapping factors in knee OA symptoms. Okay, so our first question with our overall study is that what are the risk factors for falls in knee osteoarthritis? We published a systematic review regarding the risk factors, and we've conducted a systematic review of observational study designs that included participants with knee OA, and a history of falls were considered. Okay, so we use PubMed, Sinal, the usual e-databases. We get around first around 2,000, 3,000 studies. But in trying to use our inclusion criteria, we've found out that the risk factors can be divided into intrinsic and extrinsic risk factors, particularly balance, strength, proprioception, knee instability, pain, the number of symptomatic joint, and the comorbidities. And one external factor, which is the use of walking aids. So what we saw is that the main finding is impaired balance, decreased strength, and increasing number of symptomatic joint, and the presence of comorbidities were the risk factors with moderate evidence. And in assessing a patient with knee osteoarthritis as a clinician, we should look at the ability of our patient to, of course, to have a steady stance and to check their balance, and at the same time develop a fall prevention program, particularly in this patient population. And of course, some additional studies investigating risk factors are warranted. So I'm trying to establish why do I choose NeoA and falls in using this type of exergaming, right? So I didn't stop with a systematic review. So what I did is to conduct a cross-sectional study. So despite the increased number of falls, the mechanism and contributors underlying the occurrence of falls in individual with NeoA are poorly understood. So what I did is to examine the relationship right now between falls and the clinical characteristic of NeoA. These characteristics were informed by the systematic review. So I chose the variable of balance, pain, instability, muscle strength, and physical function. So based on this examination, what I did is to measure their balance using a balance platform, a master balance platform, wherein I use the sensory organization, sensory inputs. And then, of course, I measure the muscle strength of the patient, particularly the quadricep muscles. And then I use time up and go test for their function. Aside from that, there's also a self-reported knee OA symptoms. So I use the knee osteoarthritis outcome scores and the knee outcome survey, particularly if there's an instability and buckling. So this outcome measures are valid and reliable. So I consider this one as a tool to measure the following variables. So based on our association, and to summarize that, balance is very important, also a factor. Knee muscle strength, and of course, physical function, particularly measured by time up and go test. Okay, based on the proportion of those knee osteoarthritis who had incidents of falling, 49% reported of at least one fall in the previous 12 months. Okay, so around, it's a bit high, half, almost half, 49% or 31 of them. In the association or the likelihood of falling, we found out dynamic balance, physical function gives us high odds ratio, wherein the propensity is high to having fall at least one time for dynamic balance, 2.44 for the physical function. And we also found out that knee extensors or your quadriceps muscle are very important in determining falls for this patient. So the main finding for this one, the fallers with knee OA had significant lower dynamic balance as reflected with the composite scores. So the composite scores came from the balance testing that we did. Compared to non-fallers, those who fell had significant lower muscle strength, particularly flexor and extensors, with more emphasis, of course, with the extensor muscles, and decrease in function showed by increased risk falling by 2-folds. So I think in dealing with our patient, particularly with geriatric patient, of course, cognizant with the aging process, balance is very impaired with the aging population. So we need to be very careful. Even though it's a knee osteoarthritis, we must check also the balance and the risk of falling of these individuals. So given those two background of knee osteoarthritis and falls, I think it's very important to give an innovative or solution to acknowledge these risk factors and impairment. Of course, exercise are proven to have a beneficial effects such as balance exercise delivered by us, by physiotherapists or physical therapists. Physical activities such as walking, traditional exercise, such as Tai Chi are very famous to very famous fall prevention program. But as we all know, adherence is considered as one of the challenges in implementing exercises, since beneficial effects decline if regular exercise is not maintained. So therefore, identification of an enjoyable and engaging balanced exercise is very important. And in order to sustain balance, in order to sustain patients doing these balanced exercises and its benefits, individuals must really engage with this kind of exercise. So I think this one will connect falls and exergaming. So given those enjoyable, leisure activities for them, maybe we can incorporate technology. And so during that time, I was thinking that, yes, there's a lot of technology available, particularly the highfalutin laboratories for virtual reality. But I was thinking, let's look for a more low cost or cost effective intervention for them by using what is available in their homes. No? For example, the Nintendo Wii Fit. And of course, I used the term exercise and gaming together for specifically for my research. So I always use the term exergaming. Some use active gaming or game exerciser. That's okay, but I think we still fall under the same category. So during the time, if you see here that most of the research about exergaming falls with the use of Nintendo Wii Fit. So here it's around 79% that uses Nintendo Wii Fit. Some use PlayStation, some use Xbox Kinect. So I'm focusing more on the commercially available or off-the-shelf gaming consoles. Okay, if you look at the patient population, there's a lot of studies about older adults, no? And of course, there's a lot for neurologic conditions like multiple sclerosis, Parkinson's disease, and CVA or stroke. But I'm interested during that time, is there really a protocol for balance? So what I did, we published a synthesis review of a protocol, because of course there's a protocol for the intensity, for the duration of for example, increasing strength. There's also for balance, definitely. But what if we use an exergaming? What will be the protocol for older adults and what system works? So based on this narrative review, we found out that there should be an investigation on the safety, dosing, and the setting of the Nintendo Wii Fit. Based on that synthesis, they like Wii games like Table Tilt, soccer heading ski. If you know these games, maybe you play with your kids, or maybe you have the first hand playing this kind of gaming in Nintendo Wii Fit. And the protocol that actually we synthesized varied from 15 to 70 minutes. The frequency is once a week or 3 times a week. And the program duration is between 3 weeks to 20 weeks. So still, there's a need of investigating on the mechanism behind on how and why we use this kind of technology. So gaming is important. The dosing is important. Of course, safety of our patient is very important. And of course, the setting and the environment where they use this exergaming. Will I use this exergaming or this platform at home? Or can I just use this exergaming inside the clinic or the hospital? So what I did to follow up that is the main study. So of course, this is the first time that study use it in the knee osteoarthritis population. So of course, it's very important to have a step of a feasibility study before a full-blown randomized control trial. So I started first with a pilot study, but I'm trying to of course to put to my study to another level, which by doing a mixed method approach, because I think quantitatively we can measure the improvements, but I want also to see and of course explore what are their perception? What are their experiences in using this kind of technology? So I use a mixed method exploratory sequential approach. So the first part is a quantitative rather, study or component wherein the participant play for 8 weeks. So I have a pre and post test assessment. And then after that, they went to a qualitative, I interviewed them through a focus group discussion. So of course, the parameters and the protocol was informed by the narrative synthesis. So of course, I chose those games that will have an impact based on research as well. Particularly, I focus on balance games. But there's also a warm up and a cool down exercise included in their program, as well as yoga as part of their routine, right? So these are the intervention that I use. So we had 3 times a week. So the two sessions were done at home and one session at the clinic, so that they will know how to operate the Wii Fit. So I myself go to their houses and then went to their houses and then tried to fix and install the Nintendo Wii Fit so that they can play. So of course, the outcome is the number of recruitment, the feasibility outcomes, the retention, the compliance, and of course, the safety. Okay, so these are the a priori or the definition of my recruitment and the feasibility. If Nintendo Wii Fit or playing Exergaming is feasible for this population, if the assessment period is okay, and if the intervention protocol, the duration, the frequency are all appropriate. These are the outcome measures. So the outcome measure was informed by the cross-sectional study that I've mentioned. So we have dynamic balance. I also check for the false risk, the symptoms of knee osteoarthritis, muscle strength, physical function, and of course, the fear of falling. And then the next part is my favorite part because I want to see how, of course, they know how to play. Some of them know how to play, but what are their experiences, right? So I had my guide questions and started my semi-structured interview to a focus group discussion. So I used this key questions, particularly how they find the testing and the assessment, the intervention, and have some probing question to them. So when we had this one, I used a thematic and a template analysis and a general inductive technique. So noting for the feasibility and the safety, as well as their experiences and the acceptability. So what will I report right now are the some of the clinical outcomes or changes and improvements. So for the feasibility, 77% with compliance, 88% with retention rate. So they continue and finish the program. And for the safety, luckily, there's no adverse effect. So I don't have any incidents of falls. I don't have any incidents of back pain, neck pain, or even wrist pain for the patient. So assessment, they find it just right. It was not too short. It was not too long. And then very clear with the instructions. It's not too complicated based on the intervention that we delivered. So the clinical outcomes that have some improvements are this one. So for the KUS or the knee osteoarthritis outcome score, with particularly with their activity, sports recreation, and quality of life. So you see that there are some changes increasingly. So higher score is actually improvement. There's also an improvement baseline, interim, and post-intervention with the composite score. That's the balance. So they have higher score in balance. Again, it means better balance for the patient. And then there's also a decrease in the time spent in doing the time up and go test. Therefore, there's an improvement in the physical function. What's also interesting is that even though it's around 8 weeks, we saw a bit of changes in improvement in knee extensor muscles. No? So if you look at all the strength, there's actually increase. However, we cannot put any significance on this one because it's just a pilot study. So you will see here that there's some interesting changes with the outcome. But again, because of the number of the sample size and the nature of the methods, we cannot really confirm the significance of this one. So when I talk about now the experiences, acceptability was assessed by asking the participants with the experiences of the use of this kind of exergaming, the Nintendo Wii Fit. And most of the participants experience high expectation that it would be fun, that would help their knees, of course, their balance, and of course managing their symptoms while playing this kind of exergaming. So the themes that emerge from their experiences, number one, exergaming boosts motivation, interaction with exergaming, and barriers in using exergaming. So the first theme is supported by enjoyment. So exergaming boosts motivation. They are motivated because they enjoy. Okay, they enjoy the game. It was very interesting. Right? So three of my participants are really happy with with the use of exergaming as part of our physical therapy management. Aside from being they enjoy the game, there's also a sense of competitiveness and a sense of accomplishment. So competitiveness because they are playing against with an avatar, right? So they have a goal. And then there's also a sense of accomplishment because as I've mentioned a while ago, this kind of technology was really created for younger adults. And sometimes they felt that, oh, it's a positive reinforcement. It's accomplishment that I finish a specific level or a specific task in the games. Or for example, they done with the course of that specific game. So there's actually what we call the sense of interaction with them with what we call a theory in psychology, the flow theory. So flow theory and self-determinant are the two principles that I've learned from this exergaming. What is flow theory? So flow theory is that there's a concept of time flies. So you're playing even though you have a knee pain. I remember one of my participants playing, well, no, there's a bit mild soreness, but I can still play. So they enjoy, they continue their exercise, even though they are feeling something, not really good. So you're in the zone of doing that specific activity. There's also a self-determination because they want to finish the course. They want to finish the level and continue playing. And thus, I'm also taking advantage of them moving their knees and moving their bodies. Okay, so they are already exercising. So that's the first theme. Exergaming boosts motivation. The second one is that interaction with exergaming. So there's an interaction with the technology. Like, hey Donald, I can really manipulate with I can manage to set up the Wii Fit. I can press this one. So they're engaged with the technology. And of course, there's a social and family interaction. There's a concept in a geriatric population, what we call intergenerational relationship. So sometimes they play with their kids, they play together with their loved ones. But of course, it's not just positive, it's not about enjoyment, it's not about interaction. There are also some barriers. So what are the barriers? Repetition. So sometimes, if they finish a specific level, of course, they went to the clinic and then play again. So sometimes they got bored with those levels and challenges. So that's one of the disadvantage of those off-the-shelf or commercial-based exergaming. And then accuracy. Sometimes the sensor are not really working together with their movements. So I already finished this one, but again, because of the sensor, they cannot proceed with the next level. So accuracy and repetition are some of the barriers I got from this study. So based on this one, what I developed is actually a figure wherein showing that there's an increasing acceptability and increasing engagement. If there's motivation, if there's an interaction, then an individual can increase the acceptability of this kind of technology and increasing engagement playing Nintendo Wii Fit, playing maybe other off-the-shelf platforms or technology devices. So there's an increasing engagement and also increasing acceptability if they have these two components. Of course, there are some barriers given the technology that we have right now. So some of the theories and reason for engagement, self-determination, and flow theory. So in summary, it appears that it's feasible to conduct a randomized control trial. There's some interesting trends of improvements in the outcomes for knee osteoarthritis, dynamic balance, physical function. And participants indicated positive experience with the study and exergaming program. Lastly, participants enjoy with We Fit games and found it motivating, interactive, in spite of some barriers with the use of this form of technology. So if you want to know more about this study, we just recently published this one in Physiotherapy and Practice, and hopefully you can also publish some of my work in the archives of physical rehabilitation and medicine, right? So this one is the mixed method study that I presented. So if you want to know the details, the parameters that we use, you can download our article, our publication. And right now, since I already started with this kind of exergaming older adults, I'm also looking on ergonomics. So we are playing this kind, particularly with the shoulder upper extremity. So what will be the effect of exergaming to them? And we are also investigating right now with the use of the head-mounted gears. So maybe there's neck pain while they're doing, particularly in geriatric population. And then aside from this one I'm playing with one of the equipment for driving and maneuvering. So aside from the ergonomics, we're also are right now investigating in well-being, particularly in the community-based rehabilitation. So our intention right now is to bring, given our setting in the Philippines, so Manila is the urban area, we want to go to rural area so that they can also experience technology in their setting, particularly in our partner affiliations. So in summary, I think I shared to you my experiences with the knee osteoarthritis and falls, how exergaming relate to falls, and of course, how exergaming relate to this particular patient population, patients with knee osteoarthritis. Right? So I think the battle and the search for exergaming and any other technology that will benefit our patients still continue. Okay, still continue in investigating. It's not yet the finish line, and I hope that in sharing this one, exergaming can be part of your intervention. Exergaming can be part of our physical therapy kit that we can use, that we can utilize in order to prevent adverse effect of this condition or any other condition, and of course promote physical activity so that we won't miss the beneficial effect of exercises. All right, I think I'm good with it.
All right. Thank you so much for that talk, Dr. Manlapaz. That's very interesting. So the floor is now open for questions. So if you like to voice out your question, that's all right. If you're a little shy, you can use the chat feature. Are there any questions? Okay, I'll start the ball rolling.
Sure. Yeah.
Okay. All right. So my first question, actually I have a few, but my first question, doctor, is about limitations. So you talked about osteoarthritis, and we know that there is a certain degree in osteoarthritis that eventually we can't do anything anymore. So until until when do you recommend the exergaming? At what stage of osteoarthritis have you met patients who you have to say, oh, I'm sorry, we cannot do exergaming anymore?
Yes. So that's a good question, right? Because first of all, assessment is very important. A holistic assessment of our patient is very important. So for this one, if I'll use the platform balance, before asking for the severity of knee osteoarthritis, can the patient have a good dynamic stance or balance before playing? So that's one consideration. With regards to the severity of osteoarthritis, mild to moderate osteoarthritis can be beneficial with the use of this platform. No, so but for the severe, that's one of our exclusion criteria. If there's a severe OA or knee OA or even hip OA, because some of them will have not just the knee OA, but also the hip OA. So there's a combination. So we try to not include them. But those with mild and moderate that can do standing, a good dynamic balance, and of course, able to maneuver with the technology, then yes, they can use the Exergaming.
Oh, okay. All right. How about cognition? Are
Yes.
there issues on cognition for this one also?
Yes, but through our screening, we use the mini mental scale for our patient. No? So here, cognition is there's of course the scope of the study is more on balance, but reading the literature, there's also some beneficial effect of doing like this kind of game. So it's not just about standing and playing. You can also sit and try to use exergaming based activity in sitting position. And then there's also a training mentally. So cognitive wise, it can be, of course, it depends on the setup of the inclusion of the study, exclusion of the study. So if cognition is severely impaired, then I think the patient or the participant cannot really, understand even the instruction of setting up. So cognition is one of important consideration, but somehow in some of the studies, exergaming can be very useful for them, of course, to train their mental exercise.
Okay, thank you for that. How about
Thank
our
you.
audience? Are there any questions?
I can ask a, oh, sorry, Julie is asking a question in the chat box.
Okay, we have a question in the chat. So
Yes.
Julie Faita said, were there any issues with visual or vestibular factors with any of the participants you worked with?
Yes, we basically excluded those with vestibular problem, just for safety purposes. But with regards to the use of WeFit, because it's a semi to a non-immerse, so technically they can still have the outside environment. But with our platform balance master testing, we identified those who are risk. So we excluded them already in our cohort of participants. But still, yes, issue like for example, after playing games, sometimes they are a bit dizzy, particularly if they're doing the boxing and some of the jogging because they just jog in place. So yes, it's a consideration. And I think going back to my slide about safety dosing. So I think that's one of the consideration that we look further into our research and practice.
Hi, Dr. Manlapaz. Yeah, that was a great presentation. I really enjoyed it. I have a similar background using virtual reality and multimodal training for patients, for older adults and patients with neurodegenerative conditions. So I really appreciated your talk. So the first question that I had kind of touches on what Noemi asked, like beyond the fun and engaging factor, what are some additional benefits of exergaming for osteoarthritis? So that was my first question. And then the second question is, and I don't know the answer to that, so I hope that you can help me. So the Wii balance board was a tremendous commercial success and found many benefits in rehabilitation research, especially for balance assessments and balance interventions as a low-cost assessment tool, no longer use of force platforms, and also for balance interventions. But then for some reason, we or the Nintendo company decided to put it out of commission, I believe since 2017. So we're now almost 5 years in, and I haven't seen a good replacement of a similar balance board system. So I was wondering where you see this low-cost technology evolving towards, so that individuals, older adults and individuals with neurological conditions can continue to use this type of technology.
All right, so I'll answer first the first question. So the first question, aside from balance, it's also about managing their symptoms. Of course, we know that osteoarthritis will have pain on their knee. So some of my patients reported that if they're playing and moving, so it's beneficial for them. And it seems that they are not exercising; they are just playing. So it's we actually target two things right there. So the benefits of exercises and the motivation for them to do some physical activity. So it's more on their symptoms. So aside from the balance, strength, I think for the strength, we need more a longer cohort of studies to prove that there's really an increase in strength. But technically, with the symptoms that they have, it decreases. It decreased with my participants. So balance, pain symptoms, and stiffness of the knee. So those are the components that were improved. For the second one, I agree with you. To be honest, during my last part of the experimental study, I need to be creative, because what I did, because they stopped already manufacturing the Wii Balance, I posted actually everywhere that if you have the Wii Fit just inside your cabinet, inside your drawer, can we please get them, and then we can use this one for our participants. So yes, that's a challenge, but with the use right now of the new Nintendo's Wii Switch, so they also have the nunchuck, but yes, I agree with you. There's no platform, the pressure sensor that they have previously. So hopefully they can manufacture one wherein it's just like a thin and not really, because the problem with balance is a bit high. So some of my participants like trip when they go up, but of course there's no problem, there's no adverse effect, but they're sometimes careful with it during the first start. So yes, I don't have the answer for that, but that's a good thing that we can knock the doors of the manufacturers or the big companies doing Exergaming. And of course, my call is that let's put some physios inside their decision making, so that if they really want to pursue with entertainment going to health purposes, then I think they should include physiotherapists or any sports exercise scientists. So that's it. I think that's the rally and call to them.
All right. Thank you so much for that, Dr. Manlapaz. Yeah, I also hope that the entertainment department would include physiotherapists. Please wait. Please wait for me. That's one of my goals too. Okay. Is there any other questions in the audience?
Yeah, I have a question.
Go ahead.
So thank you for your amazing presentation. And I guess it may be a silly question, but do you have any chance to ask participants about how they perceive the Exergame as a more like exercise or more like gaming? Because for me, like gaming is like fun and I would like to do more, but the exercise is fun, but not fun.
Yes.
So maybe it is related to their motivation, inner motivation. So I just wondering like whether they perceive it, how they perceive it.
Yes, actually, I can answer that with the compliance and the when I look at my feasibility studies, compliance and their motivation to exercise, because I check their attendance. What I've observed with my participants, at first they really love to do it, and so I have 100% attendance towards the fourth week, but after the fourth week, I think there's the barrier, the repetition. So they somehow, I think 2 to 3 of my participants did not complete one of the sessions. So I think at the start they really like it, but the challenge right now is how to be more creative so that we can go back again with that motivation, that creativeness, and that motivation coming from that gaming, to become gaming as part of the exercise. I got you with that exercise. Yes, it's very difficult to exercise and exercise only. But what I'm suggesting right now, based on what I've got with their perception about it, at start it's okay. But I think what we can do, we can use exergaming as an adjunct, right? Like for example, they can do the formal exercise, and if they are not exercising and they want to continue to exercise, they can use exergaming in between. So I think that's the only thing that I can suggest based on the interviews that I've got from my participants. So hopefully their perception just, I think, lasts the benefit or the enjoyment lasts for the first four weeks, but it declined, but they finish, maybe because they sign a consent that they need to finish the duration of the experiment. But of course, we don't coerce them. Yes, thank you. Thank you. I hope it can be like in between so that we can still maintain the motivation to exercise.
All right. Are there any other questions? Are there any other questions?
I think none. I think thank you for I just saw the chat box. Thank
All
you
right.
everyone. Thank you
I
for
think we
listening, and thank you
can
for
wrap
yeah,
it up.
thank you for the questions. Yeah, thank you. Yeah. It's actually 1:58 in the morning in the Philippines, so it's almost 2 a.m. I'm still up, I think.
All right. So I think since we have no more questions, thank you so much, Dr. Manlapaz, for giving time and sharing your expertise with us. And hopefully we can still see you in the future. So yes. And also I would like to acknowledge Dr. Patricia Hines. She's the head of our aging research geriatric networking group. So he said, thank you so much for the presentation. And the presentation will be available at the ARGRNG website. So we will be sending you also a copy of it.
Thank you.
So thank you everybody for staying
you.
with us for an hour. And I hope you had and you enjoyed our lunchtime webinar in the United States. And for those who will be watching this, thank you so much for participating and watching. I hope you learned a lot. So this time we'll be signing off. I'll be turning off the recording.
Thank you.